Okay, can all of you see the screen? Can just someone tell me if the screen is
Yes,
visible
sir.
or
Clear,
not?
sir.
Clear enough?
Clear, sir.
Okay.
Yes, sir.
Once again, I'm sorry. I wasted 15 minutes. Uh, Unfortunately, it has been raining very, very heavily here, and that is the reason I got late from the office. Okay. So, yeah, as discussed in the earlier presentations, we completed three presentations to discuss the overall life cycle in formulation development. And now I'm taking this example presentation of albendazole tablet, USP 200 mg. This is the format of the first presentation which you prepare when the project has been allotted to you and you complete your literature search. So formally, once everything is done, your literature search and innovator related characteristics, once that is done, we prepare this presentation and we give this presentation to all the cross-functional team. So, what I will do today, I will take you through this presentation, whatever is possible, and half presentation I might take tomorrow or whenever it is feasible because mostly I'll be traveling tomorrow. And then once this presentation is done, maybe in two or three lectures, one by one, how to do the literature search and all, we will again keep on revising this presentation, and each topic we will take again and again, what to search, where to search, and how to search. Uh, so I'll take it at that time. Right now, we'll just go through the presentation to understand what information is required here in the presentation. So now consider that this is a project which has been allotted to me for formulation development. I have to develop a generic version of albendazole tablet USP 200 mg. This project has been approved in the management team by the management team, and it has been given to R&D. So I will start. I will do the first. I will do the licensing activity. Once licensing activity is done, again, so now once you do that, first thing is that you start working on the drug substance part. So this is something information which we capture from the drug substance. So there are many places from where you can get the drug substance part. You can get it in the DMF, open part of the DMF. Or DMF is nothing but drug master file. So whoever is manufacturing the API, once you have a clause and CDA signed with him, he will give you the open part, so the information can be taken from there also. Then, when you get the innovator samples, you get the project information leaflet with it. So, in this project information leaflet, also you can get a lot of information. Then, through Google, also you can search, and then there are many search engines where you can search. So once you search those activities, following will be the requirement for formulation. First thing is that it is white to yellowish powder. This is important because here you should know whether it is powder form, amorphous form, or crystalline form. Always try to understand because your manufacturing process will depend upon the type of the form. If it is powder form and if it is very fine, you will have a different process. If it is somewhat crystalline, you might have a different process. So this is important. Chemical name is methyl 5-propylthio 2-benzimidazole carbamate. Now this name might not sound something very important to you, but when we go to the impurity sections and all, usually impurities are interconnected with the chemical name of the API. So there this might come handy. Chemical formula, we put the information, but usually not required. But again, to identify what the functional group are there, and if there is any incompatibility with any of the group present, this chemical formula will always help you. Molecular weight, mostly required for calculating the amount of drug which you have to put. If it is a salt and if it is a free base, you have to see based on the label claim what you are going to claim. According to that, you have to do. So if in that case, there is a factor calculation number required for which this molecular weight might come handy. Then there is a CAS number, not that important, but again, when you give this CAS number, you are sure that your vendor is sending you the same drug. Most important part is the BCS classification. So in this case, albendazole is class 2 drug. So this is the most important part of formulation development. This is your heart of formulation development in determining what is the solubility of your API. So in this case, it is BCS class 2, means the solubility is low and the permeability is high. So there are 4 type of classifications, that is the class 1, class 2, class 3 and class 4. So out of these 4 classes, class 1 drugs are the most easier to formulate and develop, and class 3 also somewhat better. Uh, the difficult most drugs are usually the class 2 drug and the class 4 drug. So in case of class 2 drug, the solubility is low, permeability is high. And in case of class 4 drug, the solubility is also low and permeability is also low. So these drugs are usually the drug which poses or which gives you the major of the challenges. So whenever starting with the formulation, first you have to check the solubility. Based on the solubility, it will determine what will be your process, what will be your strategy, what is required to increase the solubility, that is also an important thing. What is your solubility, how to increase the solubility. If you know the solubility, then only you will be able to design the strategy to increase the solubility. Then what are the techniques you can use to increase the solubility and match the dissolution with the innovator. So if it is a class 1 drug, in case of class 1 drug, I took class 2 drug as an example because class 1 drug is very easy to formulate, and many a times in case of class 1 where the solubility and permeability is both high, and if at all the drug is releasing 80% of drug, higher than 80% in first 15 minutes, usually you can get a biowaiver. And even if you are not getting a biowaiver, if the dissolution is somewhat slow, still it is very easy to formulate a BCS class 1 drug. If required, maybe once we complete this series, I might take an example of class 1, but I wanted to take a case of class 2 because this is where the major work goes on. And then this, as we go further and further, we will discuss this classes classification in detail. So solubility, it is freely soluble in anhydrous formic acid, very slightly soluble in ether. Albendazole is practically insoluble in alcohol, and it is insoluble in water. Of course, since it is a BCS class drug, it will be insoluble in water. So solubility and BCS classification goes hand in hand. Then comes the polymorphic form. So now someone might ask me why this polymorphic form is important. So first of all, when a polymorph is different, the way of approach of your development will be different. Then some polymorph are more stable and some polymorph are less stable. Some polymorph are more soluble, some polymorph are less soluble. So it is always advisable to go ahead with the same polymorph which the innovator is using, or the polymorph. You can always change the polymorphic form, but it will not be a normal ANDA. It will be a different type of ANDA. This we will discuss separately when we go there. But when you start identifying the polymorph and which polymorph is the most stable polymorph or soluble polymorph, this is important because you can pick the polymorph. But in practice, we don't go that way. In practice, we try to get the polymorph which is present in the innovator because it makes our life easy. And usually the polymorph is mentioned in the PIL, or sometimes the API vendor will tell you which is more soluble polymorph or which innovator might be using. They give you this information, and from this information, you can get the polymorph. And based on the literature search and all, you have to choose this polymorph, and you should choose a polymorph which is more stable, and in case of class 2 drug, which is more soluble. This is general theory, but still it is always better to match the polymorph with innovator if possible. Then this is all about the introduction slide. Next, we'll move to the next slide. So, once you do that, then you will try to get the information of the innovator. So there are various ways to get the information from the innovator. You can get the innovator information from multiple source. First thing is that get the innovator. You get the once you get the innovator from the PIL, you can get the information. If you know the innovator name, for example, in this case, this is Albenza tablet. You just put the name Albenza in Google and mention PIL. You will directly get the PIL. There also you can get the information. Then there are other sites also from where you can get innovation information like rx.com. So you can get this information, but mostly, majorly, we take this information. If we have not yet received the innovator, we take this information from the PIL, that is the project information leaflet, product information leaflet, which comes with the bottle of the innovator. If you don't have the sample, you just put the name of the drug, name of the innovator, that is Albenza tablet, and mention PIL in front of it. In the first 2 to 3 search only, you will get the PIL. This, once I complete this presentation, I will show you how we search it. So Albenza tablet is the name of the innovator brand. Of course, the active ingredient will be 200 mg, strength is 200 mg, manufactured by GlaxoSmithKline, Mississauga, Ontario, Canada. This is important because you have to have this manufactured by information. Based on that only, you will have to select a innovator. And when we move forward, I will tell you how the related substance is chosen. Usually the, sorry, not related substance, the reference standard is chosen. The reference standard is mentioned in the orange book. I will let you know how it is chosen once we go there. Then description, of course, this is very important. White to off-white, circular biconvex tablet, bevel edge, film-coated tablet, tilt-tab tablet is debosed with AP and 550. Now, why this information is important? Because in generic, you have to match closely with the innovator. There are two reasons. First thing is that if if your formulation is going to replace the innovator, then your description and physically it should be almost same, so that the patient doesn't get confused that what has changed in your product. So for marketing, it is important to match it. Second thing is that uh, there is a guideline for size, shape. So in the guideline for size and shape, there are some constraint, and there are things mentioned, and there are some restrictions put on how much you can deviate from the innovator. So this guideline, I have a plan to completely discuss in detail. As of now, just consider that there is a guideline because of which we need to understand what is the innovator, what is its shape, whether it is biconvex, plane, it is having score line or not. Everything is important. Suppose in this case, score line is not there. If there is a score line, then there comes, if you put the score line in your product, you have to do the breakability study also, and then there is a guideline for that also. So maybe these guidelines we will come to at later stages. One by one we will discuss. First, we should complete this presentation once, and then we will keep on repeating this presentation with respect to the guidelines. So inactive ingredients, of course, if you know the inactive ingredients from the PIL, this will always be helpful, because the first strategy, if a patent is not there, the first strategy is to match all the your Q1 and Q2 composition with the innovator. This will help you to get a bioequivalent product. If the product is having patent and if you are not able to copy it, then it will become a different thing. But again, in that case also, you should know what is present in the innovator, then only you can define a para 4 strategy or how to bypass the patent. So these are the innovator ingredient. And then from these ingredients, once these ingredients are enlisted, try to understand the function of each ingredient in the innovator. This will help you to design your formulation. Then storage condition. This is also important, that store at 20 to 25 degrees Celsius at control room temperature. Sometimes if it is a liquid, the storage condition might be different, and if it is some other dosage form, it is might be different. For some molecule, because of the nature of the API and all, we might give a different storage condition. So always this is important, and we should try to have a same storage condition as that of innovator for our product. Then pack and NDC number, this is again given in the PIL. So in this case, the bottles of 2 tablet and bottle of 28 tablet is the pack. So why this information is necessary? Because whatever innovator packs are there, you have to have the same pack. It gives you a advantage of replacing the innovator when your generic is being prescribed. Then once you do this introduction slide and then the reference products trail, then you have to try to understand the kinetics of the product, because you are going to make a generic formulation. So whenever you make a generic formulation, you have to do a bioequivalence study. So you have to get this pharmacokinetic properties. So these pharmacokinetic properties are again available in PIL. If you Google it, again there is available. And then most important thing, you can get a lot of this information from your freedom of information, that is the drug package tech pack. So once I complete this presentation, I will share, or I will, what you can say, I will just show you how to get the tech pack, from where to access it, and how to get the biopharmaceutical review from there, and how to evaluate the biopharmaceutical review, what information we can take. So for the same presentation, we will come back, and then we will see how to take the, how to get the biopharmaceutical review. So now these are the parameters which we have to see for our kinetics. So first thing is that albendazole is poorly absorbed from the GI tract due to its low aqueous solubility. Of course, if it is solubility is low, its absorption will be hampered. Then albendazole concentrations are negligible or undetectable in plasma. So this information you get from your PIL, and or the DMF, the open part of DMF, or you might get it from the Google also. So you hear what it says, that the concentration of albendazole, because the drug is low soluble and permeability is also hampered because of extreme low solubility, you don't get a proper concentration in plasma, and that's why it is undetectable. That is what it is saying. And most importantly, in this case, as it is rapidly converted to the sulfoxide metabolite. So now there are two things. Sometimes the drug gets converted into blood, into a different metabolite. So we have to have that metabolite. We have to check that metabolite in the plasma, and sometimes the drug might remain as it is, so you have to check that. So this is a very important information. So with this slide, whenever I will present this slide now, and if a clinical person is there, it is a hint for him that what he needs to see. He will be aware that he cannot detect albendazole, so either he will um, see what is the, he will go to the bio guidance section, and he will see under bio guidance, US FDA, what is mentioned, whether albendazole has to be measured or its metabolite has to be measured. That's why this is a important slide. Then Tmax 2 to 5 years. So when the Tmax is given 2 to 5 years, based on this Tmax, you can understand which media you should target to have a very good idea about your bioequivalence study. We will see as we go forward what is the dissolution media, how to go ahead with it. So, but then Tmax and Cmax usually at the time of, so in this case, if the Tmax is 2 to 5 years, Ideal media can be 0.1 normal HCl or 4.5 acetate buffer, because if it is giving you highest concentration in 2 to 5 hours, means either it is in the stomach or it has just crossed the stomach and it is into the small intestine. So depending on the pH of stomach, which is 0.1 normal, and the pH of intestine, you might take 4.5. And suppose if your drug Tmax is very highly delayed, then you have to have 6.8 or 7.5 media, depending on from what is the Tmax, you can understand from where your drug is getting absorbed. So this is important. Absorption we discuss. We will again discuss with case study for albendazole only. What are the details when we go to the biosection of this part. Then effect of food, again very important part. Here it says oral bioavailability appears to be enhanced when albendazole is co-administered with a fatty meal, as evident by higher up to five-fold increase in plasma concentration of albendazole sulfoxide as compared to the fasting state. So now why this information is important? So if this formulation have been in Europe or UK, then in case of Europe and UK, if there is a no food impact, then you have to do only the fasting study. Now this is showing that there is a food impact. So in case of Europe and UK also, you have to go with the fed study also. And then now when you go to the bioguidance section, mostly in this case, both the fasting and fed study will be required. We will again see the bioguidance section, how to access the bioguidance and what to derive from the bioguidance once we go there. So effect of food is important to determine what type of studies need to be done. Again, when the clinician is present, he will understand that in this case, while administering for the fed study, he will have to have a high fat content diet or fatty meal. This is a information specifically mentioned for him. Then distribution, albendazole sulfoxide is 70% bound to plasma protein and widely distributed throughout the body. This might not be of that importance for us, but for clinician, it is again important. Then metabolism and elimination, this is again for formulation development. It might not be important, but it will be a very important information for the clinician. Terminal half-life, so terminal half-life ranges from 8 to 12 hours. So this terminal half-life usually helps us to understand what is going to be the half-life and how and from where your drug is going to be. Just give me a minute, lights gone.